Do we really value the efforts our doctors have put in this COVID fight? What will be a real tribute to our doctors beyond the one-liners that our netas in particular seem to give out? Joining me now are guests, 3 of the 4 of whom have actually gone through COVID themselves. Dr. Kunal Sarkar, Chief Cardiac Surgeon and Senior Vice Chairperson, Medica Super Speciality. He didn't have COVID, but he's been working tirelessly on COVID relief. Dr. Anita Soni is an obstetrician and gynecologist who also had COVID herself at the Hiranandani Hospital. Dr. Akshay Budhraja is consultant Department of Pulmonology at the Aakashhealthcare Super Speciality. He also is a COVID survivor. To term with Dr. Akshay Budhraja, you want to share your story also as a COVID survivor who is a doctor?
Yes, sir. Good evening.
Good evening.
So I had a mild COVID. Luckily, I was blessed with 2 vaccinations before contracting COVID, and I was isolated for 2 weeks. And during these 2 weeks, I used to do teleconsults. I used to take telephonic hospital rounds, read about the new research, the new medicines, how to help the admitted patients and help the patients recover faster and how to decrease the mortality. But I lost a very close brother-like friend of mine who was just 35, and that made me even more anxious, and I was so desperate to join the hospital back and help the sick patients by treating them and aggressively before it's too late. And despite that, we lost many young COVID patients. And it was just my sense of duty and sense of purpose which motivated me. And it was a very emotional and physically exhausting journey. So during, especially the second peak, that was the most dreadful time. The most challenging experience was the shortage of oxygen, medicines, beds and staff. And I had no answer to so many of the patients' queries, how to procure a medicine, how to find a bed with oxygen.
But when Dr. Budhraja, you saved a life, let's say you get, as you said, you lost a friend of 35 years, a 35-year-old friend, it drove you to go back to the hospital to save other lives. What's the feeling of a doctor when you save a life?
Yeah, so I was the happiest when a patient recovers, and I always share that joy with my friends and family and my wife especially. But when a patient succumbs or the patient remains on ventilator or on high flow oxygen for a long time, it may make us anxious and mentally affected. But if a patient recovers, it is the smile of the patient, the joy the family gets when they are discharged in a healthy state. That is very satisfying.
You know, I'm getting a sense from you all about, but I want to know, Dr. Budhraja, we'll end on a positive. We're going to end on a positive. What's the best thing about being a doctor? All 4 I'm going to ask you. You start, Dr. Budhraja. Best thing about being a doctor?
So there are a lot of best things, but the best thing is to see a patient getting discharged in a healthy state. That is the best thing, and the smile on the patient's family's face. And that is the only best thing.
So the smile is your the smile is your reward, right?
Yeah,
the smile on a patient, the happiness. Yes. Thank you all very much for joining me and sharing your stories of what has been a very difficult year for you more than anyone else. Thank you for joining me on the show. Now remember,